Welcome to the Power of Food podcast. We are so excited to bring you evidence-based nutrition information focusing on addressing the root cause for imbalance. Food has the power to help you achieve lifelong optimal health without the side effects of prescription medication. Subscribe on Apple Podcasts, Spotify, or any other podcast platform. I am Stacy Seslowski, functional nutrition registered dietitian.
And I am Leah Grace Barrick, functional nutritionist.
Hello, everyone, and welcome to the Power of Food podcast. We're so excited to have a special guest on today, Jennifer Brand. Jennifer Brand, MPH, MS, CNS, is an integrative and clinical nutritionist and the CEO of Jennifer Caryn Brand Nutrition, LLC. Jennifer helps children with dry, flaky, weepy, red, itchy, painful rashes navigate the journey to healthy skin and enjoy a childhood free from disruptive skin symptoms. Instead of managing symptoms with more restrictive diets, environmental changes, and prescription creams, Jennifer uses functional testing and detailed health history to uncover unique imbalances at the heart of the problem and provides a roadmap to restore balance so that your child can eat more foods, feel good in their skin, regain normalcy, and be a child. Jennifer's own struggle with gut problems and disordered eating, made worse with elimination diets, and her father's, brother's, and mother's struggles with psoriasis, eczema, and vitiligo left Jennifer frustrated. Conventional recommendations fell flat and didn't help her or her loved ones get relief from these health problems. These experiences inspired her to search for a different approach, one that addresses the root causes of health problems like these. Jennifer has been a faculty member of Learn Skin, and her work has been featured in peer-reviewed scientific journals, Voyagelo, as well as on podcasts, online summits, and in-person presentations at venues such as Casa Colina Hospital in California. Welcome to the Power of Food podcast, Jennifer.
Thank you so much for having me. I'm really excited to be here.
Amazing. Well, we're so excited to have you and talk all about why elimination diets haven't resolved child's problems with rashes, and it can actually make things worse, which is really, really interesting. I don't work with a lot of kids. I don't think, Stacy, you do either. Correct me if I'm wrong, but I know a lot of my clients have kids who often have these problems. So we'll definitely have a lot of people who are really interested in this. And I would love to just start by you kind of establishing what the difference is between food allergies, food sensitivities, and food intolerances, because I think there's a lot of confusion about that.
Yes, absolutely. And before we dive into that, I just wanted to get started with some statistics, because eczema affects more than 10% of children in the United States, and that number continues to increase. And one of the first interventions that people go to is an elimination diet. It's recommended by conventional practitioners, by holistic practitioners. Anywhere you go online, one of the first things you're going to see if you're searching, my child has eczema, they're going to have you start taking foods out of the diet. And I'm really passionate about parents knowing that food is not the root cause of their child's eczema, which is why elimination diets don't solve the problem, certainly not long term, and they can cause a bunch of others like nutrient insufficiency and deficiency for kids, and they can cause stress, anxiety, and depression for parents, because food is medicine, right? And if there are reactions to foods that are grown on this planet, it really doesn't make sense that they would cause problems. So, and I should point out too that by the time people find me, my clients find me, they have cut out processed junk foods already. So cutting out junk food and, the processed sugary foods is not what we're talking about with an elimination diet. But so by the time people find me, they are eating healthy, whole, real foods, but the diet is still getting smaller and smaller, and the rashes keep coming back. So for anybody listening, if you do have a child with eczema and you're relying on food eliminations to solve the problem, I'm really glad that you are listening, because it's my mission to help children like yours with those dry, flaky, weepy, red, itchy, painful rashes navigate the journey to healthy skin and enjoy a childhood free from disruptive skin symptoms. And I want you all to know that what the root cause of the problem really is, how to find it, and what to do about it so that your kid can eat more foods, feel good in their skin, regain normalcy, and be a child. And we're going to talk about all this today. But so back to your question, food sensitivities, food allergies, and food intolerances, because there are differences between these, and it's important to understand what they are because it can make a big difference in how we tackle a child's diet when they have rashes. And by that, I don't mean take more foods out of the diet, but rather like how we can actually add more foods back in. So a food allergy, so first of all, is an IgE immune response. So these are reactions that happen really fast, like within minutes to an hour, usually at most. These types of reactions can cause hives and itching, rashes and rash flares, gut symptoms, vomiting, swelling, trouble breathing. These are the reactions that can be anaphylactic or life-threatening. They're typically identified by a skin prick or blood testing, or your doctor may recommend oral food challenge, which you can do with their guidance in an office, which is often something that I would recommend. If your doctor advises to keep certain IgE identified foods out of the diet and others in, those are important recommendations to follow. There is a greater chance for developing IgE food allergies when common allergenic foods are not introduced, and an even greater risk for the development of food allergies if your child does already have eczema. So this is why your allergist may recommend, getting those foods in through the diet, which wasn't the case years ago. It was like, don't introduce peanuts, don't introduce dairy, don't introduce those foods. Now we want to introduce those foods when baby starts eating solids around 6 months to help reduce that risk for developing food allergies later. And also, it's even more important to introduce those foods if there are not already identified allergies to them when your child has eczema, because you can get sensitized to these allergens through a broken skin barrier. Always work with your healthcare provider if you're concerned. But so then we have the IgG immune response, and these are the food sensitivities that are delayed. Like, they can be delayed up to 72 hours. So these are those frustrating reactions where you think it's food, but you're not sure, right? And these are the types of reactions that can cause similar symptoms to an IgE reaction, but they're not life-threatening. So these can be identified by blood testing or oral food challenge or short-term elimination diet. So we'll talk about that too. And my recommendation for these to my clients is that if you can pinpoint that certain foods are actually triggering symptoms, then yes, it does make sense to keep them out, but while you're healing the gut. So this is important. So what IgG reactions mean is that there's gut dysfunction and leaky gut. So when I see IgG testing, often there are lots of different like low reactive foods identified, for example. That's not something that I would recommend to my clients to eliminate from the diet. If there are high or moderate findings on that kind of testing, and you can identify that they're actually causing problems, then I think, sure, it makes sense to keep those out of the diet while we are working on the root cause and healing the gut. Again, talk to your practitioner about this too. I'm not necessarily your guys' practitioner out there. But typically, once we start working on the gut and healing that up and resolving the imbalances in there, people are able to expand their diets pretty quickly and include those foods again. Some food sensitivity testing actually looks at IgA levels also. So those are a different type of immunoglobulin. They're made by mucosal tissue, like the gut lining. And levels of that can be high when the immune system is hyperstimulated. And that tends to indicate like chronic stress, inflammation, irritation. And high levels can indicate damage to mucosal tissues and therefore leaky gut. And then we have the food intolerances. So these cause symptoms like an IgG reaction or an IgA reaction, not life-threatening either. And it results from an inability of the body to metabolize our food or like different foods. An example is lactose intolerance. And this isn't something that's going to show up on like the allergy or sensitivity testing. And then a lot of my clients I see have like a combination of these things happening at the same time. Yeah.
Gosh, there's so many different questions that are running through my mind and everything that you said, and I'm sure we're going to get to all of it. But even just to start, do you, as a first step with your patients, do you recommend an elimination diet, or do you skip that step and really just focus on healing the gut?
I skip it and really move to healing the gut. So when we're talking about an elimination diet, and again, so many kids end up on these diets to try to solve the problem. It is a number one go-to aside from things like prescription steroid creams. But again, food isn't the root cause of the problem. And when we're talking about an elimination diet, so I do I would say by the time most people find me, they're already on these restricted diets, right? So it's more like, okay, which foods do you really feel are causing reactions? Can you identify those? And a lot of times my clients say, yes, this food, that food, et cetera, okay. If you know it's causing a problem, keep it out. But very often I hear, I can't really tell. I took out all these foods. It helped for a little while, but now there are reactions again. So I don't know. I'm like, yeah, that's not the food. So what happens is like a true elimination diet is something that we want to undertake for like a month. I mean, 21 to 30 days at most. And the idea is that by taking the foods out, we're going to start to identify, we're going to get some symptom relief, and we're going to start to be able to identify which foods are causing trouble. So after that period of time, when the suspected foods are taken out, the idea is to reintroduce foods one at a time in a controlled manner to see if they're triggering symptoms. But again, and like already alluded to this, what's missing in this process is that food isn't the root cause of the problem. If there are food reactions, there is increased gut permeability, which most of us have heard of leaky gut. So that's what's happening. And so when there are problems in the gut, so gut dysbiosis is abnormal flora in the gut. So our gut microbiome is made up of a bunch of different bacteria, fungi, parasitic things. There's viruses in there. It's a very hostile environment, and all of this stuff is supposed to be in there. It's supposed to be in a particular balance. And with imbalances, so when these things are like overgrown, we could have high levels of stuff we don't want, low levels of stuff we do want. There might not even be any gut symptoms going on, by the way. So this is common too. Like we're talking about all this stuff happening in the gut. Somebody might not have any gut symptoms at all. But so when all of this stuff is happening in the gut and we get these imbalances in there, we get irritation and inflammation, which causes the gut lining to get permeable or leaky. Now what happens is that we get toxins from the gut into the bloodstream. So that can be food particles, which is why we start getting food reactions. But the other thing that's getting through the gut lining are toxins from gut bugs. So we're blaming food, and it might not be the food at all, because when we eat, digestion also creates an increased die-off of gut bugs and more toxins. So we're blaming food, but it might not be the food at all. And so what happens is when these things get into the bloodstream, the immune system starts to recognize them as foreign because they're not supposed to be there, mounts an attack, and in many people, it causes rashes like eczema. So leaky gut is why there are food reactions in the first place. And so I always like to point this out because there's this belief, I guess, if you will, that food sensitivities are causing the leaky gut. The leaky gut is there, which is why we have food sensitivities in the first place.
Amazing. I love how clearly you just broke that down, because I think so many people get so confused, understandably so, because there's so much happening. And especially with elimination diets, like I think, just letting people know the goal is to increase resilience so that we can have the most food. We can have our kids eating whatever. We don't want them to have to avoid X, Y, and Z forever. So I love that you're doing that and getting to the root cause, which is, often leaky gut and immune problems rather than the food itself. So if parents are putting their kids on an elimination diet, is there anything that they should know? And does that differ between ages? So like if you put a baby on an elimination diet versus like an adolescent, what's kind of like the difference between those two, and what should parents really know about the whole process?
Yeah, good question. So I would say, if you're just starting out and exploring, triggers for what's happening with your child's rashes, it does make sense to look at the diet. In terms of what goes in, we do we want the diet to be as broad as possible. And we're talking about healthy, whole, real foods, forget about the processed crap. We're not talking about that in terms of an elimination diet. But we want the diet to be as broad and inclusive as possible because that fosters a diverse gut microbiome. Gut diversity, microbiome diversity promotes better health. So that's number one, like why we don't want to take too many foods out of the diet. If somebody does want to try an elimination diet, I think it can make sense to try it for like 2 to 4 weeks. If you're taking a bunch of foods out of the diet and within 2 to 4 weeks you haven't noticed a difference or symptoms come back, because often when somebody takes foods out of the diet, they will get a temporary reprieve from symptoms, but then symptoms come back. So it's this vicious cycle. So take foods out, feel a little better, symptoms come back, got to take more out, feel a little bit better, rashes come back, got to take more. So we end up on this vicious cycle. So that's what I want people to really avoid. So short term, okay. The other thing is that we really need to be nourished to heal our rashes. So our bodies run off of nutrients from foods we eat. That is fuel. And we need that fuel to build and repair healthy skin. So healthy skin requires a lot of different nutrients. Of course, these come from the foods we eat, which means we need to eat rather than restrict. And kids are also growing and developing. So pound for pound, they already need more nourishment than we do as adults to grow and develop. And that's happening quickly. They're active, right? So they're burning through these nutrients and they're on a healing journey. So they really have a higher metabolic need for nutrients in general. And, here, a common recommendation, elimination diets. Like it just doesn't make a lot of sense when you start thinking about it this way, right? And so babies in particular, like I've seen skin rashes get worse the more restrictive the diet becomes. And it's really not a coincidence because now the body doesn't have all the fuel it needs to do everything that it's supposed to do. And, when we're talking about like giving the body that fuel, it does have sort of like a hierarchy of needs. That fuel first is going to go to, it needs to keep the heart beating and the lungs working and the brain functioning, and the skin is kind of like lower on the totem pole. It's not quite as important as like functioning organs. So all of these nutrients go to these other places first. So we need to make sure that the right foods are getting in. And, again, in particular for babies growing and developing, it's a very impressionable age. I have seen children develop fear of food and disordered eating habits like very young. I mean, 4 or 5 years old, and kids are walking around saying, I can't eat that. That's not good for my skin, things like that. And it's just not something we want to hear. And then when we're talking about like adolescents, teenagers, that's a whole nother category of and challenges that come along with trying to do an elimination diet with this group. I mean, here we have teens, for example, or the adolescents that hanging out with their friends, they want to do their own thing. It's going to be hard to encourage them to eat healthy foods as it is. And then if we start restricting things, that's a whole other types of issues. Eating disorders become very prevalent at this age, especially in young girls. And the growth and development, again, certainly if your kid is active in sports, females growing and developing, we need enough nourishment for proper hormone function. So, we start to get into those types of issues as well.
What about our breastfeeding moms? Should they be eliminating their, having an elimination diet themselves, or, kind of what advice do you give those moms?
So nursing moms, yes. Should they be on an elimination diet? And the short answer is no. Breastfeeding, when you're able to, is truly a perfect food for baby. There are research-based allergens that can get transferred through breast milk into baby. And those are things like, our fish and shellfish, soy and dairy and nuts and gluten and eggs. So those can get through. However, elimination diets are not recommended for a mom while she's nursing unless there's a clear connection between the food and an allergy and a reaction in baby. So this is different. Like if you're breastfeeding and your child has identified food allergies, the IgE food allergies, and your doctor wants you to avoid them, then yes, you should avoid them. Otherwise, there's no clear connection. Is it the food? Is it toxins? Is it something else? The child's gut bug cycle? It could just be that. So, the short answer is no, but there's always shades of gray. Mm-hmm. And then when you're thinking about mom nursing too, like mom needs those nutrients for everything that her body is doing. And certainly she has higher metabolic needs during this time too, because she's making food for baby.
Totally. Yeah, that makes so much sense. So if there are food sensitivities, what testing do you typically recommend for that?
Yeah, and it's not food sensitivity testing. So what I do recommend, and especially if their reaction to so many different foods, like just you play around with your elimination diet for a few weeks. Again, just a few weeks, that's it. But I get the best results in my clients when we really start looking at what's happening in the gut. And I do that with a comprehensive digestive stool test. So put the food sensitivity testing away, and start to look for the root cause of the problem. And that is what is happening in the gut microbiome.
Thank you for saying that. I agree I have very similar feelings about food sensitivity testings for all types of ages and people. So let's really get to what is the root cause. We've already sort of discussed the fact that it might not be food sensitivities and eliminating foods might not be the best first step. So what is the root of the problem? And let's get into sort of how do we heal the gut?
Yeah, good questions. Yes. So if there are food reactions, there's increased gut hyperpermeability or leaky gut. And this is happening again because of that gut dysbiosis. So the imbalances in the gut microbiome, which are creating that state of irritation and inflammation in there, and causing the food proteins and endotoxins, which are the toxins from the gut bugs, to get into the bloodstream. So what we really want to do, and what the stool test, the comprehensive digestive stool test, shows us, is the makeup of the gut microbiome. So once we understand what's happening in there, we can create a plan for someone to help address those findings. So when we start addressing those findings, that's when we start getting relief on the skin, as well as gut microbiome imbalances are a root cause for many other things, which we're not talking about today. But I find that, my clients with the rashes, a lot of them have lots of different food sensitivities, lots of other symptoms. They might not necessarily have gut symptoms, but watery eyes, runny nose, mood, behavior imbalances, things of that nature. So when we start addressing the problem from a root cause perspective, we do start to see improvements in all of these different areas. And when we're looking at what's happening in the gut, and I think a lot of people have probably heard of a 4R protocol. This is how we, sort of in our world, in the functional medicine world, like resolve what's happening in the gut. And so these are important steps that you need to take. And when a lot of my clients that come to me will say, well, yes, I'm addressing the gut. I know it's important. I'm giving him or her a probiotic. That's a very small piece of the puzzle. So, what we want to do is remove things that we don't want in there, which can be overgrowth of bacteria, fungal findings, viral findings, parasitic findings. So we want to make sure that we address all of those, remove things we don't want. We want to re-inoculate. Or we want to replace actually first. So we want to replace, which is, does somebody need help with digestion and absorption? So this kind of testing, the comprehensive digestive stool test, can show us if somebody has enough digestive factors. So if we're not digesting and absorbing our food appropriately, that can leave stuff in there for this dysbiotic stuff to feed off of and overgrow. And so we want to make sure somebody has what they need to digest their food. Then we want to re-inoculate, which is get the good stuff in there. So this is where we do start looking at some different forms of probiotics, different prebiotics. And depending on what's happening in the gut, can be different for everyone. So this is why, the probiotic that you might have picked up at the supermarket or, wherever might not be doing any good. Number one, it might be the wrong kind of probiotic for what's happening for your case. Number two, these other steps need to be incorporated as well. And then we also want to repair the gut lining, and that can be done with any number of different types of supplements, even some food-based interventions. One of the most popular interventions here is glutamine, and that is actually not something that I recommend in my practice at all for a number of different reasons. And so everybody is different, but so when we are looking at the root cause of the problem, which in my practice I find, especially with kids, really are these different types of imbalances that are happening in the gut. These are the type of steps that we want to take to resolve them. So it involves the testing and then like going through that process to make sure that these steps are accounted for to resolve those imbalances in there.
Yeah, I love that you use the 4R protocol because it is so complex. And I see so often people when they're looking to like improve gut health, they'll go to the supermarket and look at a probiotic, and that's about the extent of it. And so you really have to dive so much deeper, especially that remove part that you were talking about that I'm sure comes up with so many of your clients. So I'd love to hear, what's one of the biggest mistakes that you see people making when they're trying to heal rashes?
So I would have to say focusing on diet alone, or, focusing on that elimination diet, or focusing on clean laundry detergents and clean, household products and all cotton and, all of the organic, etc. Or just focusing on different types of creams on the skin. So really, it takes a village, so yes, we have to focus on making sure the right foods are getting in to have the body nourished. We do want to mitigate any potential triggers that are environmental. We do want to protect the skin barrier because, again, like a broken skin barrier does put somebody at greater risk for the development of food allergies. So we want to do all of these things, but none of those address the root cause of the problem. So we need to look for that root cause. And again, I find that really is what's happening in the gut. There are also a lot of different pieces to the puzzle, and everybody's puzzle is different. And so because of that, there's no one size fits all plan. So I think another mistake people make is, following the one-off recommendations, or, seeing something online, like this probiotic is going to, heal everything, which of course is not the case, So just because something is promoted online, or your best friend or your neighbor, somebody, that you follow, just because something maybe worked for them doesn't mean it's going to work for you. It's unfortunately not that simple.
That individuality piece is so important to emphasize, because that's why people get such mixed information everywhere, and they think, that certain things are supposed to work and they don't, and it's because you are different, you are unique, and just because they worked for other people does not mean they're going to work for you. So you've mentioned a few times to make sure that people are eating the right things. So what foods would you emphasize in people's diets? And what are some things that people can do, sort of like leaving today right away to get themselves moving in the right direction?
Okay. Yeah. Very good question. So what to eat?
Yes.
Oh gosh. Well, number one, and this comes to mind first because I just got a question about it from somebody who's not a client of mine. Somebody reached out with this question, and they were saying that they noticed that their child seems to flare when he eats carbs. So they're trying a low carb diet. And I'm not even sure how young this child is. This is not a client of mine, just somebody who reached out with questions. So they're trying a low carb diet and asked my thoughts on that. So number one, carbs have gotten a bad rap, I think, over the years, and they are important. So we're not talking about sugary carbs. So sugary processed white flour carbs, those can be triggering because sugar is inflammatory. It triggers the immune system. Sugar actually contributes to skin barrier dysfunction, gut barrier dysfunction. But complex carbohydrates, so things like nuts and seeds, quinoa, brown rice, gluten-free grains, buckwheat, sweet potatoes, your starchy, non-starchy vegetables, these types of carbohydrates are really important to eat because they feed your good gut bugs. They're prebiotic. When we feed our good gut bugs, they make short chain fatty acids, which help modulate inflammatory responses of the immune system. So these short chain fatty acids are super important for keeping the immune system in check, and they're actually found low in people with eczema. So number one, complex carbohydrates are really important. Variety, we always say a rainbow assortment of vegetables and fruits. I like to say vegetables first because fruits, most kids love fruit because it's sweet, but we want to make sure that we get in bitter foods, and vegetables are great for that. Bitter foods help stimulate digestion, so that's a really good thing, especially when we're talking about all this stuff happening in the gut. Vegetables and fruits are also very rich in antioxidant nutrients. That's something else that I see low in a lot of kids with rashes. Inflammation, which comes along with rashes, allergies, other allergic conditions, is the result of oxidative stress in the body, and we can combat that with antioxidants. They come in fruits and vegetables, so we need to eat those foods. Healthy fats are really important. So avocado oil, olives and olive oil, coconut oil, nuts and seeds in their butters. So fatty fish, great sources of omega-3 fatty acids. So healthy fats are really important for lowering inflammation. Our cell membranes are made up heavily of lipids. And so we need to get, including our skin cells. So we need to get these healthy fats in for cell structure and for hydrating the skin as well. Protein, super important. The amino acids that proteins are broken down to in the body are the building blocks for every structure in the body down to the cellular level. There's a myth that, we eat too much protein. There are lots of myths around protein. I actually find that most people, especially on a healing journey, are not eating enough protein because those amino acids, again, and we're talking about kids who are active, growing and developing, just their bodies are doing a lot and they're trying to heal. So a big mistake I think that people make too is not getting in enough protein, especially when they're on a healing journey.
Totally.
So I think those are the basics, right? Your protein, fats, and carbs. You got your macronutrients. All three are really important. And then in terms of your micronutrients, all are really important. Those antioxidant nutrients in particular, though, I have done some nutrient testing on kids over the years. And yeah, I do focus more on the gut, but it is really interesting when I've done the testing to see really across the board that kids are low in these critical antioxidant nutrients. And compared to some of the adults I've worked with in the past that I've done the same testing on, adults not as low as these kids. It's really interesting.
So interesting. I was actually literally about to ask you if you find that a lot of kids that come to you are deficient in nutrients, because I know a lot of kids are also very picky eaters. So I would imagine that plays into all of this. And like if someone's trying to do an elimination diet and their kid also refuses to eat like 9 out of 10 things they try to feed them, like it's going to be impossible to hit all of those needs that they have when they're growing so much. Do you do like a lot of supplementation with kids? Like how does that normally work? I know when I was younger, I like refused to take vitamins. So I don't know if you use like gummies or powders and water. I'm just curious about that because in my brain, I'm thinking like, oh, this and that could probably be helpful. But obviously with a kid trying to swallow a supplement, like I would imagine it's a whole thing. So I'm curious about that.
Yeah, it can be a whole thing. You're right. It can be tricky to resolve the imbalances, the types of imbalances that we're talking about that are causing, these types of problems on the skin. There are supplements involved. A diet, we can talk about elimination diets for, the Candida diet where you're taking all these things. These diets do not resolve the types of imbalances that we're talking about here. So in addition to making sure the right foods are getting in, we do use supplements to help resolve the imbalances. There are some powders, there are some liquids, there are some chewables. They don't make a lot of these supplements specifically for children. So some things are in capsule form. And so it can be tricky because these things don't taste great. But, we can open capsules, we can put them in smoothies, we can put them on a little spoon with, if your child's old enough to have honey. Manuka honey is a great carrier because that in and of itself has antifungal and antibacterial properties, and you can mix a little something with that. So I do work with my clients in terms of finding creative ways to help their children take some of these supplements.
What would you recommend for moms who are fearful that their babies are at higher risk for developing these things in the future? What can they start to do even like prior to any signs that of their baby having rash or eczema?
Yeah, so there are some research-based strategies to help lower the risk of eczema as well as food allergy in babies. So moms, while pregnant and breastfeeding, moms should eat a varied diet, healthy whole real foods, and include the top allergens. So like as long as mom's not allergic, include the top allergens. Also pregnant and breastfeeding, mom, eat omega-3 rich foods. So those are like the fish, salmon, halibut, mackerel, flax seeds, chia seeds, avocados, and you can always take an omega-3 supplement. Pregnant and breastfeeding, again, mom, supplement with vitamin D, get your levels checked, before you get pregnant, ideally, while you're pregnant, dose accordingly, get follow-up blood tests, make sure your vitamin D levels are in check. From a conventional perspective, that number tends to be kind of low. So you may want to work with a functional practitioner to make sure that your vitamin D levels are optimal. We also want to check gut health. So for mom, like preferably before conception, and address existing imbalances that you have. A lot of the kids that I work with, parents, moms have gut problems or, autoimmunity and are very familiar with the role that the gut plays in overall health. So mom, definitely check what's happening in your gut as well as what's happening in baby's gut. So, and also while pregnant and breastfeeding and then during infancy for baby, probiotic is always a good idea. My go-to are spore-based probiotics. If I can mention one, there are a number of them out there, so I don't have to mention it. But anyway, spore-based probiotics are my go-to. The research on those, it shows that they can actually make it down to the large intestine or the colon, which is what we're talking about when we're talking about the gut. They can make it there. So most like bacterial strain probiotics aren't getting down to where they need to go because this environment is so harsh. They get killed off by stomach acid and other things happening in there. So the spores can actually get to where they need to go. It's also, if you can get your nutrient levels checked, preferably pre-conception. So moms, do some nutrient testing. Make sure that you have the fuel that your body needs to do everything your body needs to do and grow a human. That takes a lot of fuel. So if you're deficient, likely your baby's going to be low in some nutrients. Also, when we're introducing solids, you want to do that on time. Sometimes that is not possible, but where you can, usually that's around 6 months. So introducing solids like too soon or later than that increases the risk of developing allergic conditions, food allergies, certainly. If there isn't an existing food allergy, that's the IgE, just make sure you're getting all of those allergens in through the diet. Starting at 6 months, you can start introducing those along with the other foods. And then if your baby already has eczema, then, again, make sure that if your baby has eczema and doesn't have identified food allergies yet, get those foods in through the gut before there's a chance to get sensitized through the skin.
Do you find a major difference between kids that were born vaginally versus C-section? Do you see a lot of that in your practice in terms of any skin problems, eczema, that kind of thing?
And this is so interesting. So I see like equal numbers of both. And I know there's a lot of like mom guilt out there when, the baby's been born C-section and, mom couldn't breastfeed and mom had antibiotics during delivery, like there are all of these things. And yes, I have kids in my practice that has been the history and they have eczema or other rashes. And I have just as many kids in my practice that were born vaginally, breastfed for extended periods of time, never had any antibiotic exposure, like everything is perfect. And they have rashes too. And so, yeah. And so people who are C-section, exposure to antibiotics, formula fed, there's a greater risk, but it doesn't necessarily mean that somebody is going to develop these problems versus somebody who hasn't gone through all of that.
I think that's a really important point also to emphasize is just like so many moms have this guilt when they're not able to breastfeed or when they had to be on antibiotics or these things. And I think the stress and the guilt that they put on themselves could actually be a risk factor for more other problems. So just taking away that guilt is so important. Do you have any thoughts on anything topical? Would you actually put breast milk on their skin or rashes as a topical? Even if it's just a short term, obviously the root cause is their gut and their food intake and things like that. But what about, something like that on topically?
I've heard of some parents that do that and have seen that to be helpful. What I typically recommend is, and I do have a free guide, it's called Tips to Ditch the Itch, and it's just different things to try topically. We want to protect the skin barrier. Some of the newer research that I've come across is we don't want to use food-based products on the skin because with a broken skin barrier, we're more likely to develop an allergy to them. So best types of things to use on the skin are tri-lipid creams. So creams that contain like ceramides, cholesterol, and free fatty acids, because those are nourishing to the skin. There are different products that are probiotics for the skin, prebiotics for the skin. Those help protect our microbial populations on the skin. That's important because those microbial populations help regulate our skin barrier function. And so low levels of good bugs on the skin can contribute to skin barrier dysfunction and rashes like eczema. So we do want to use those moisturizing like tri-lipid type creams, or again, the pre-probiotics. There, you can do soothing baths. There are a variety of those. A lot of dermatologists and doctors recommend bleach baths. I have a lot of clients that do that and get some good results from it. Everybody is different. If your dermatologist recommends or your doctor recommends a bleach bath and you want to give it a try, that it can be helpful because a lot of people with rashes like eczema have higher colonization of staph bacteria on the skin. And there's an active component in bleach. It's called sodium hypochlorite. It kills off the staph on the skin. So that's why, like, for some people, those types of baths are helpful. It's the same idea. Like if your child goes swimming, like in a swimming pool with chlorine, and that seems to help, it's similar. It's killing off the staph on the skin. But there are other kinds of soothing baths that somebody can take as well. It's really challenging to find things to put on the skin that are soothing. And again, everybody's different. So for example, those tri-lipid creams, like they work for a lot of my clients, and then I have other clients and I just hear, no, burns everything I touch them with, burns the skin. And so in cases like that, sometimes I have a client I talked to earlier this week, Vaseline is the only thing that this mom can put on this kid's skin to like keep that moisture in. And, here we go with the mom guilt again. She's like, I don't want to put this on my kid. It's so bad. You know what? If it's what's helping, put it on. Like if it's helping, that's okay, and certainly when we're working to address the root cause of the problem and that's in process. If you have to put something on the skin that isn't super favorable, not your favorite thing to put on, but it's helpful, don't have the guilt about it. Your child doesn't have to suffer and struggle while we're addressing the root cause of the situation. Like, give them that relief. And if that means using something even like a steroid cream, I know people are going to hate me for saying this, but it's true. Like, if you have to use it, that's what it's there for. It's when we use these things not as prescribed for extended periods of time and things like that that we run into trouble. But for symptom management, sometimes it's helpful. That's what it's there for.
So interesting. I've never heard of the bleach bath, but like
No.
I know Stacey and my faces are both just like
that one is really interesting. And this is a little tip too. So that sodium hypochlorite, which is why the bleach baths help, there is a particular product out there. It's called CLN. I've seen it at Walgreens and places like that. And it's a body wash. And so I let my clients know this too. I'm like, well, if you've done a bleach bath and it's helped, you could try this product because it's just the sodium hypochlorite and it doesn't involve like an actual bleach bath. It's a body wash. So some people find that helpful too.
Very interesting. Yeah. And I wonder like what that's doing to the rest of the skin microbiome on the body that's not affected. Because I know some people even recommend like not even using soap on your body, that kind of thing, because you don't want to disrupt the microbiome. So I can only imagine what this super harsh chemical is doing to the rest of your body. And if that's even like making problems worse potentially down the line. So yeah, that's really interesting, especially about like the chlorine in the pool too, because usually, especially in like functional medicine, we're like, not the chlorine, you're like, so all the chemicals. But I'm curious, like how long does it normally take to resolve skin rashes? I'd imagine it depends on the individual, but is there kind of an average amount of time?
Yeah, so everyone's health journey is different, and no two clients that I've have had the same protocol or combination of imbalances. But I would say on average, I tend to start seeing improvements. So, like after we've done the testing, once we get somebody on a plan, most people start to see some results like within 3 to 6 months. I'd say like 6 months is kind of that average where I really start to expect like changes to happen. And it doesn't necessarily mean that the problem is solved by then, but I do expect to see something by then. I've had clients that I've had some over the years where it's like, oh, it's been 3 months. Oh, and you're done. Okay, great. Like that's more on the unusual side. And I do have some other clients where, we've been working together for, about a year or more. So it just really depends. And it depends on how long it's been happening. If it hasn't been happening as long, usually it gets resolved faster. It depends on what types of imbalances we find and how many different types of imbalances we find, because we can't address everything at the same time. We can do a lot of things together, but sometimes it's more of a process. Like we start here, we do this for a little bit and then we have to switch gears. It also depends on how consistent people are with the interventions. And we talked about that. It can be really challenging with kids. So, I find that we're not looking for perfection with recommendations. It's persistence and consistency over time. Kids are a moving target, and there will be some days where maybe even weeks where, the kid is just like, it's just not going to be possible to get this stuff in. And that's where I tell parents, don't bang your head against the wall. It's just going to, the stress is going to be triggering for everybody. Just step back, give it a minute, and revisit it, when the time comes. So that consistency and persistence can, change our timeline a little bit. And then finding the right combination of things too, because again, everybody's different. So once, we start addressing those imbalances for somebody in particular, it's like, okay, how is this person going to react to these different, interventions, these different supplements? Because everybody's reactions can be different. So we might have to pivot. But yeah, so basically, as you can tell, right, this is not a straight line at all. And it's just everybody's completely different. And we just have to pivot when we find that something isn't working and then keep going. But the most important thing that I find is just, again, remember that it takes patience, persistence, and consistency. Skin can be a slow process. And just don't give up. Like, parents, just don't give up. That's number one.
Yeah, it's so important. It's such a trial and error. I always tell people we're not just the first thing we do is not going to be the answer. Hopefully it will be, but you just don't know that. And, it's like I tell them the more we communicate and the more we stay in touch and you let me know what is working and what is not working, then we can just keep making new recommendations to just keep addressing and we'll learn each other. You just learn the baby, you learn the child, you learn as you go. And I think keeping hope, like you said, is just so important.
Yeah, number one. Yeah, and so much of it, I think with life in general, so much is mindset. If you don't believe that it's possible,
Yes.
it's not going to happen.
Yes.
Like, when you believe something's possible, you take the steps to make it happen. So it's not just saying, oh, I believe this is going to happen, and you can sit back and watch it happen. It's like, I believe this is going to happen. Therefore, because I believe it, I'm going to stick with this. I'm going to persevere. I'm going to not give up. And when that happens, that's when you get the results that you're looking for.
Yeah. I literally had this conversation like just right before we got on this podcast with someone. And I said, the doctors that, unfortunately, the doctors that tell you, like, oh, there's nothing I can do, or this is how it's going to go. And they give you these like sort of negative, like expectations of what is going to happen in the future. I mean, that puts you in that mindset that is the way it's going to be. And it really does change, I think, the trajectory of the way, the outcome of the patient. So I think I love that positive attitude. Well, this has been just so informative. Honestly, I learned a whole bunch of things. I know I'm going to be like listening to this again and kind of taking notes. And I really do appreciate it. And I know I speak for Leah as well. We appreciate you being here. Are there any just last minute takeaways before I put up your, where we can find you?
Yeah, I mean, I would say just, the most important things to remember are that your child's body has to have the fuel that it needs to do everything that it's supposed to do, including building and repairing healthy skin. So remember to nourish instead of restrict. And also, if there are food reactions and if there are rashes, check what's happening in the gut microbiome.
Amazing. Well, thank you so much, Jennifer. Can you tell our listeners how they can find you?
Sure. So I do most of my research posting. So a lot of this type of information, as well as a ton of other types of information, you can find on my Instagram. My handle is Jennifer Caryn Brand. So it's JenniferCarynBrand. That's also my website, jennifercarynbrand.com. So those are the two main places that you can find me.
Wonderful.
Awesome.
Well, thanks so much again, Jennifer. Like Stacey said, I'm excited to listen to this and learned so much, and it was so informative. So thank you. You're clearly so passionate about this too. So your clients are definitely lucky to have you.
Well, thank you so much for having me. I'm thrilled to have this discussion with you guys. And yeah, I hope that this is helpful for anybody listening to this. Give you hope and know that you can get to the bottom of what's happening with your child's skin and get them the relief that they're looking for. You can help them expand their diet. They can eat more foods. They can have healthy skin. They can have a normal childhood.
Love it. I love the fact that we're adding food back to their diet rather than taking away. I think that's so important. So for everybody else who's listening, my name is Stacey Seslowski. I work with, my company is called Heal From Food. My email address is Stacey, STACY @healfromfood.com for anyone who would like to email me. And Leah, would you like to say a little?
Sure. Yeah. And I'm Leah Barrick. You can find me on Instagram at Grace Functional Nutrition or my website, gracefunctionalnutrition.com.
Have a great day, everybody.